a dozen states rallying to demand an end to Medicaid cutoffs. The protest organized by the Nonviolent Medicaid Army.
If we can unify, we can create a movement of poor and working class people, and we can change the system.
We are taking action together as the National Nonviolent Medicaid Army.
I didn't fall through the cracks. I was pushed by systems that ration care, criminalize need, and treat survival as a privilege.
We will not die in silence. That's what this day is about.
Went down to the rich man's house and I took back what he stole from me. Took it back. Took back my dignity. Took it back. Took back my humanity. Now it's under my feet. Under my feet. Under my feet. Under my feet. Ain't gonna let no system walk all over me.
We are taking action together as the National Nonviolent Medicaid Army in more than 10 states across the South, Midwest, Appalachia, and the Northeast to declare Medicaid cuts equals policy murder.
Medicaid cuts equal policy murder.
Policy murder. Policy murder.
Policy murder.
Policy murder.
Medicaid cuts are policy murder.
Who is the Nonviolent Medicaid Army? Those who are on or unfairly excluded from Medicaid.
So we say the change begins with the telling of untold stories.
I'm one of those that gets $23 a month in food stamps. I worked 35 years to be treated like a piece of shit.
This year alone, I've been rushed to the hospital for 4 different times for 4 emergencies. If it wasn't for Medicaid, I would be drowning in bills bigger than my future.
So I can choose to have health insurance and have no money, or have money and no health insurance.
If you're sick, it's not your fault. If you're poor, it's not your fault.
I've spent most of my life too poor to afford care. When I was laid off in the pandemic, I was able to get on Medicaid, and that was the first time in my life I was able to see a doctor on a regular basis.
The worst part of my job every day was when a mom would come to me and she would say, "Hi, I'm here to pick up medicine for my son or daughter so-and-so. You know, I need to pick up their emergency inhaler. I need to pick up my daughter's EpiPen." And I always had to be the one to tell them, "I'm so sorry, but your insurance won't cover it. I hope your kid doesn't die." They don't want to pay for you to live. They don't want to pay for your kids to live. And they damn well want to pay even less by letting AI tell you that you can go die.
With these cuts, 45,000 Vermonters will lose their insurance, falling hardest on children, who make up 1/3 of the recipients that will lose health care in the state of Vermont.
There is a perpetual war on the poor. There is a perpetual war on the working class.
Cuts to Medicaid don't just shrink a budget. They take away care from families, kids, and schools, and people living with mental illness.
When I was sick, we went to the doctor. When there was an emergency, we went to the ER. I swallowed a quarter and got really sick.
Oh, no.
My mom was always able to get me the care I needed, even when she lost her job, and we lost our regular insurance. She never had to question if we could afford to go to the doctor or urgent care, because Medicaid and Child Health Plus keeps kids like me healthy and in one piece.
Last Friday, I had a prostate biopsy. You know, earlier this week, I had teeth replaced in my mouth. I work 2 part-time jobs and I DoorDash, none of which provide medical health coverage. So without Medicaid, I could be walking around unbeknownst that I have cancer or toothless.
I came to know the NVMA at a time when I was on Medicaid, and I know now, having employer-based health insurance, that Medicaid was the best health care I've ever had.
That's right.
Because it was free. I didn't have a copay, I didn't have a deductible, I didn't have a premium, and it's free as it should be.
Yes.
Because it's our human right. Like, we should just have this.
That's right.
They are trying to kill us, murder us. And the only way we will be able to defeat this system is to organize. Because as of today, our congressmen and senators are only working for the billionaires.
We will organize. They will never silence us.
We organize, organize, organize.
You only get what you're organized to take. You only get what you're organized to take.
For the past couple years with worsening health issues, I've been unemployed. And I have been on Medicaid, which has helped immensely. My doctors have tried to order MRIs. 3 times this MRI has been denied by my Medicaid provider. So we got together, a group of us wearing our shirts, and we went down to the Medicaid office. Weeks later, I learned the denial was overturned and I got my MRI. We won!
This is actually where me and my siblings were born. The hospital where I was born is going to get shut down.
If they close Springfield Hospital, it will impact our whole region. It should not be closed, but instead be supported and supplied with everything they need.
After servicing the community for 135 years, Mount Sinai Beth Israel closed its doors this April. As the new cuts from the big beautiful bill for billionaires go into effect, more and more hospitals will be on the chopping block in New York City.
26 hospitals have closed in Pennsylvania in just the last 5 years.
The Medicaid cuts are so Elon Musk and all the billionaires will have a lower tax rate and they will get richer. And we will get poorer. And people will get sicker.
Akron largely was built through Goodyear Tire. Now our largest employer is Summa Hospital System, and Summa was just acquired by a venture capital firm.
One of our big worries is if this becomes a for-profit hospital, eventually they're going to reduce services to people that have a hard time paying.
This hospital, Crozer-Chester Hospital, was one of the last remaining hospitals in Delaware County until it was gutted and closed by Wall Street.
I worked at Crozer for over 30 years, and it was one of the happiest times of my life.
And I'm a 37-year nurse. I worked here at Crozer for my entire career. 4 months ago, 2,700 employees lost their job here.
A woman who was a former Crozer employee. She has small toddlers. She's been without a house for the past 8 weeks.
My name's Anthony. I'm part of the National Union of Homeless, which is the Philadelphia homeless chapter. If you look around Chester, there are some shiny new things opening up, and they show the priorities of those with money. You have a soccer stadium, a casino, a jail, but the people with the money chose to shut down hospitals and tear down public housing. So yes, hospitals and healthcare is a homeless union issue.
We are here demanding that Delaware County take this hospital from Wall Street and reopen it as a public hospital.
To enact eminent domain to seize Crozer-Chester Medical Center, leveraging the $11 billion rainy day emergency fund the state has.
We've also dropped some big, beautiful banners from the parking garage on I-95. So thousands of people are gonna drive by and see our message that we need a system that puts people first. Put people first. Put people first. Right now, we have a group of people who just went inside the hospital, who are sitting in and saying we are not leaving until our demands are met.
Everybody's got a right to live. We all want the hospital open. We're not trying to fight you on it, but it is private property. If they tell you gotta leave, we have to enforce that.
What does it mean when people are able to close down hospitals, deny people care, and be protected by the law?
while people demanding a hospital is reopened are arrested by that same law.
Fight, fight, fight! Healthcare is a human right! Fight, fight, fight! Healthcare is a human right! Fight, fight, fight! Healthcare is a human right! Fight, fight, fight!
Before I began organizing, I had witnessed so much suffering in my community, and my spirituality led me to ask the Lord, what do I do? What do I do? And I opened in the book of Jeremiah, right in the middle of the Bible, and I started reading, and I started getting a message that I will find my welfare by seeking the welfare of others. And the welfare that I'm talking about doesn't come from the FSSA office. And ever since I had that prophetic message, I met so many wonderful people, and I consider you guys my welfare. You guys give me a voice. You guys just give me so much hope.
I was homeless. I was sleeping behind the legislature building. ESS wouldn't house me. I was out there for several months. If we fight for each other and we unite with each other,
that's right,
instead of fighting each other,
that's right,
we'll get someplace in life.
Healthcare is a human right that should be available to all people.
That's right.
That's why I've joined the Nonviolent Medicaid Army, because this issue didn't come up just with this administration. It touched my parents' lives, my life, now my kids' lives, 3 generations.
It's important that we can continue to organize and continue to build these states up, because those of you who live in Texas, it takes 3 days for us to cross it. So we're gonna need a big army.
We are building in Massachusetts. We are new, but we're growing.
The government and the people in power are closing our hospitals because they say there is no money for them, and at the same time they give blank checks to the war machine to bomb hospitals across the globe.
That's
So
right.
it's a death-dealing system that wants to kill us all over, but we are here for each other. We are the counterpart to that death. We are live, and we need to continue fighting for our lives. Who are we?
The Medicaid Army!
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 Who are we? Nonviolent Army!
The Medicaid